So welcome to Raaonline. Good morning. So today we are going to discuss about the anti-protozoal drugs and the protozoa organisms, which includes Entamoeba styletica, Giardia, Lamblia, and Leishmaniasis and Trichomoniasis. So we are going to discuss that today, and this is what the competency we are going to see, describing the mechanism of action, uses and adverse effects of drugs using amoebiasis and Kala-Azar. And so we are going to discuss about the classification of anti-amoebic drugs and the mechanism of action, uses and adverse effects of metronidazole, which is the main prototype drug. And also we are going to see the management of giardiasis and trichomoniasis. Then the most important, leishmaniasis, which is very common in India, especially in the northern India. So we are going to discuss about the management of the leishmaniasis, and the most important drug used in the treatment of leishmaniasis is amphotericin B and miltefosine. And finally, what is the treatment regimens for these visceral leishmaniasis, we are going to just discuss. So moving on to the first section, anti-amoebic drugs. These are the drugs which are mainly used in the treatment of unicellular protozoa organisms, namely Entamoeba styletica. You can see the two forms of this Entamoeba styletica. So this is the trophozoite form, which normally we see in the small intestine, and also it is present in the large intestine. But when it comes to the large intestine, it gets converted to the cyst form. Okay, so the cyst which is there in the colon will be passed through the stools, and some people who is asymptomatic cyst passes, we need to treat that also. So it exists in two forms. One is the trophozoite and the cyst, and again this trophozoites, you can see it is attached to the intestinal mucosa, which is a flagellated organism. Okay, whereas the cyst, that means when it moves to the large bowel, then it converts to cyst, and the cyst is excreted in the stools, and which is transferred to the other person through fecal-oral route. So the water contamination, fecal contamination, so they transfer through the cyst is passed through the other person. And similarly, this mainly it is seen in the underdeveloped or developing countries because of the poor sanitation, poor socio-economic status, because mainly it is transmitted through the fecal-oral route. So these are the two stages you can see. So pathogenesis of Entamoeba styletica, say on the right hand side is a life cycle picture, where it has got two stages. One stage which happens in the humans, that is the trophozoites which exist in the tissues, like liver. Sometimes it can go to the liver. Most commonly it is present in the small intestine, luminal, and this trophozoites, as I told you in the earlier picture, which is attached to the intestinal mucosal surface, where sometimes it makes a ulcerated lesion and it enters into the bloodstream, can reaches the liver here. Okay, so thereby it can form an abscess. So it's a amoebic liver abscess. Very rarely they can go into the lungs as well as in the brain as well. Okay, so this is the most important. The amoebic liver abscess is the most important, which is difficult to treat, and especially one particular drug, chloroquine, which is anti-malarial drug, that can be used for the treatment. Okay, so that's why it is very important to know the life cycle, the stages, what is seen in the human. Okay, and then based on that you have to select the drugs. Like for example here, the matured cyst, which is ingested through the fecal-oral route, I told you, because of the contamination, it goes into the small intestine, which changes into a trophozoite. For example here, this is the cyst. At different stage it gets multiplied and it gets converted to trophozoites. Okay, this trophozoites, as I told you earlier, it gets attached to the mucosal surface. So any drug, if you want to kill the trophozoites, okay, and it directly you need to have a tissue amoebicides. Okay, in tissue amoebicides, which I will discuss you in the classification, so it will be understood better. And so trophozoites can enter the bloodstream, as I told you, can cause abscess. So in tissues only trophozoites are present, whereas the lumen also trophozoites is present only if it pierces the mucosa and produces ulceration, then it can cause acute amoebic dysentery. Okay, so where you can use two types of drugs are available, luminal amoebicide or tissue amoebicide. Okay,